Neutral position. Thumb alongside the child's jaw. Index finger on the upper lip. Mid finger on the lower lip. And ring finger just under the bony chin. In this position, you are able to provide the child with cues to open the mouth. First, by applying firm upward pressure on the chin with the ring finger. Then, by relaxing the pressure to allow the child's mouth to open naturally. Next, place the spoon, cup, or straw between the lips and wait for the child to initiate lip closure. Gradually reduce the amount of external jaw support to a 3-point hold. This hold uses the thumb alongside the child's jaw, middle finger below the lower lip, and ring finger behind the chin. Then, reduce the support to the thumb below the lower lip and index finger along the jaw. Finally, reduce support to one finger only, cueing the mouth to open and close, but be ready to provide additional jaw support as necessary. If possible, maintain arm and hand position throughout the feeding. Then, when wiping the child's face, use firm blotting motions. The child should remain in proper body alignment. If the back begins to rest, bringing the trunk and neck to a vertical position, with the chin resuming a neutral position. If the child displays high muscle tone, gently rock the shoulders. This brings the shoulders, head, and chest back into a relaxed, vertical alignment. If the child's mouth does not close during feeding, press down on the upper lip with the index finger to assist the child in raking food from the spoon. Remember, closed lips facilitate a suck-swallow pattern. The goal during cup drinking is for the child's jaw and lips to remain almost closed and to avoid tongue thrusting into or under the cup. Tip the cup up just enough to allow the liquid to touch the lips and wait for the child to suck in the liquid. Removing the cup during swallows may result in loss of head, neck, or jaw control. As cup drinking becomes easier and less external jaw support is needed, the child will begin to provide first external, then internal jaw support. Prepare the child's mouth for chewing or munching by rubbing the outside of the gums with a gloved finger or Q-tip. Rub one side of the gums at a time with firm, brisk motions. To facilitate chewing or biting, try the following. Place a long, narrow strip of soft cracker, such as a graham cracker, on the palm side of the index finger. Place the cracker inside the mouth along the outside molars. Gently rub back and forth to dissolve the cracker. Maintain jaw support for an almost closed mouth. This will reduce jaw thrusting. Rub the finger briskly across the top of the child's molars. With increased ability to munch, try placing small bits of cookie, meat, or fruit between the teeth, and use gentle downward pressure on the molars. To help the child develop more adult chewing patterns, wrap meat, chicken, fruit, or gum in gauze or cheesecloth. Place the cloth bag between the child's molars, firmly holding one end. This method allows chewing practice without risk of choking or aspiration. To facilitate tongue lateralization, necessary for adult chewing patterns, alternate food placement in the mouth. Sometimes it is easier for a child to drink using a straw because it is similar to the suck-swallow reflex. To help a child learn to drink with a straw, hold the straw, containing a small amount of liquid, between the lips. Wait for or assist lip closure. Then release the liquid. As the child becomes more experienced and gains lip and jaw control, the suck-swallow reflex will be initiated. Alternatives to presenting liquid with this method can include changing the size or material of the straw. Straws with a very small diameter present less liquid, and those cut from hard plastic tubing inhibit any tendency to bite the straw closed. Aquarium tubing can be placed in a plastic ketchup bottle. With this variation, liquid can be squeezed up to the top of the straw, allowing any sucking action by the child to draw liquid more easily. This approach can also be used with boxed juices. When beginning spoon feeding, it is important to use a spoon with a shallow bowl. Bring the spoon to the child at mouth level, allowing the head to come forward only slightly. If it is brought toward the child from above or below the mouth, the head and neck could be incorrectly aligned. For the same reason, the person who is feeding should also be at the child's eye level. In cases where the person feeding must be behind the child, a mirror may be used to allow eye contact and better child-caregiver interaction. When presenting a bite of food, verbal cues can help the child anticipate being fed and have his mouth still and ready. As the spoon is placed in the mouth, wait for the upper lip to help suck or rake the food from the spoon. This may be encouraged by pressing the spoon down on the middle of the tongue or physically assisting lip closure. Avoid raking the food off the spoon yourself by moving the spoon upward. If tactile cueing is needed to widen the mouth opening, use a lateral presentation of the spoon. There are many different spoons and spoon adaptations available for specific types of problems. To inhibit tongue thrust in the child with high muscle tone, apply pressure to the tongue base from under the chin prior to mouth opening. In addition, a tighter chin tuck position inhibits excessive jaw extension and tongue thrusting. Syringe feeding is a dangerous practice and should not be used. It bypasses the child's preparatory movements and control mechanisms. 2 drops of juice. Gradually increase the strength of the flavor until small amounts of pureed fruit are being used. Remember to proceed slowly. Encourage the child to introduce food independently, helping to build pleasant experiences with feeding. Introduce utensils playfully. Stop the movement of the spoon at the lips, allowing the child to take control. This way, the caregiver doesn't invade the mouth. Schedule food presentation when hunger will motivate acceptance. Make mealtime as pleasant an experience as possible. Everything associated with eating should be positive. If there is fear that the child may not become an oral feeder, the fear will likely be sensed and hinder the child's progress. With the techniques you've just watched, you should feel more confident when feeding children with the neurological disorders discussed in this program. And the child, feeding will become a positive experience. Remember, being fed is one of the first and most important interactions that children have with the world around them.